Hello, everyone. My name is Kelly Duan. Second year PhD student. Soon will be third year. Our research proposal is put together by Professor Miklos and Hansin and myself, and we call it Continuous Intelligent Pandemic Monitoring. So from this presentation, I'll introduce you the basic idea about this framework. And if you have any suggestions or you're interested in this type of research, please let us know so we can certainly use another hand. So far, we had a lot of good discussions about this pandemic. I believe most of us already have a basic idea or knowledge about where the issues are and what concerns the people the most. And we all know the authorities need some accurate and timely numbers to control the spread of the disease and to provide some adequate policies or instructions to the people. So we also discussed some issues with some of the key metrics that that the scientists and authorities heavily rely on. And a lot of those numbers are based on many assumptions and conditions, like what Professor Miklos was saying, the numbers of who gets tested, who's not, and there's number of tested kids. This also determine, those factors are also determining the accuracy of the numbers. And here's a screenshot from Johns Hopkins University. And this information is as of this morning. So the numbers are pretty scary. So at the early of this pandemic, some of the concerns about, or even today, about official numbers concerns us. This is also drives us to put together this proposal. We were wondering, or also want to investigate, how does the US clearly suppress all the other countries, becomes one of the centers of this crisis, and anything we can do to control the numbers. And what the
把门开下来吧，把门开下来吧，我好热。
If you're on the phone, please mute your video, please. Hello? Can you please mute your microphone? Thank you.
Okay, got you.
So we're also wondering what are the impact of the outbreaks socially and economically. One, to provide adequate policies to the citizens, and is there any early warnings or signs we should know and can prevent future outbreaks? So certainly there's a need to understand the location and the characteristics of the transmission of the virus, identify potential medical treatments, and create vaccines to fight this virus effectively. So many studies are being conducted around like discovering the common symptoms of the virus, predicting the number of the cases and deaths, identify the required numbers of medical ventilators, and so on. So from our side, we want to bring in a different view to this problem, particularly from the perspective of accountants and auditors. So using measurement science, which is accounting, and assurance science, which is auditing, to examine the situation. Also, considering our strengths, we're accounting information system. So we have the strengths and knowledge in emerging technologies and the data analytics. So we want to incorporate AI-based predictive analytics to the research. So the base idea of this framework is combining accounting methodologies and AI algorithms. And the two accounting frameworks that we consider using here is the continuous monitoring and the MEDS. And actually, continuous monitoring and continuous auditing, as Professor Miklos was saying, you're actually doing this almost 30 years at the AT&T Bell Lab. And I'm sure you will discuss about this topic now later, and I won't spoil the excitement now. But I just want to give you a very simple explanation how it works, how it impact our study in this case. So basically, it's measured, the information flows in and out of enterprise information system. So the system can capture any unusual transactions or abnormal items and flag the transactions and send alert for further investigation. So that's a simple explanation. I'm sure you will learn more about this concept later on. And we adopted this concept to continuous monitoring the development of the pandemic. And MAT methodology, simply speaking, it allows auditors to examine the full population and handling a large amount of exceptions noted based on different thresholds and criteria set up by the auditors. So it filters the transactions, prioritize the noted items to direct the auditors to risky area for further investigations. So then we want to use different machine learning algorithms, including artificial neural networks, to help us predict future potential outbreaks, as well as the adequacy policy according to different situations. So hopefully through this study, so we can improve the information quality and provide timely information for the societies and aid authorities for proper policy. So the basic idea of this study aims to establish a continuous monitoring system by using different data sources, endogenous, which is internal, and exogenous data, which is external, from the Internet of Things to continuously collect the data from various channels, systematically evaluating the available information and perform a risk assessment, predicting significant risk events, generating alert to the users for potential outbreaks, as well as providing recommendations for adequate policies for resource allocations, social distancing policies, travel restrictions, or business disclosures, and so on. So here is a very high-level overview of this framework. So basically, it has 4 stages, and the data collections, model establishment, alert system, and action recommendations. And I will talk about each stage in the next few slides. So for stage 1, the data collection. So in this stage, we are considering establishing a timely repository database of all the relevant internal and external data. So we consider the official number, like the data from CDC. Those are the internal numbers. And the data from other sources are exogenous, external. So different exogenous data can be collected, such as the social media information, Google Flow trends, people's vaccine history, medical supply related records. We already have some information about that, and some economic related data. So we actually have some undergraduate students working on this project right now, and the data that they identify is very interesting. So for the stage 2, the model establishment, at this stage, we focus on 3 different models. So the first one is the classic academic model, which is widely used in the academic study. It uses different demographic features like the population, density, age, and so on, to predict infected cases, fatalities, infection points. And one thing that I want to point out here is that the model that most study adopted is actually considering the asymptomatic situation. So the prediction results are debatable because what we always say is garbage in, garbage out. So it depends on what you fit into the model, you might get a different results. So that's what we're concerned with, how to measure, how to get the accurate numbers So you may ask, if there are many studies already doing this, why are we still doing this study? Or what is our contribution? What is our contribution in this study here? So as I said, it depends on where you fit into the model. You might get a different result. So in this case, we want to apply the audit methodology, the substantive analytical procedures to evaluate the epidemic information. So substantive analytic procedures based on the standards from AICPA, PCAOB, auditors are evaluating the information through the analysis of plausible relationship among both financial and non-financial information. The regulator actually encourages the auditors to consider to use financial and non-financial information. So in this case, we wanted to use both type of information to help us develop our expectations and then compare the numbers to the official numbers. So the same idea also applied to the second model, which is the AI prediction. So in this approach, we will use different machine learning algorithms and the neural network models, adding several exogenous time series variables and to the prediction. So we just started working on this model, and hopefully we will have some results soon. And here's a illustration about a very basic model that we put together at the beginning of this pandemic. And this is based on the official data set that we collected without considering the exogenous variables. I'm sure by including all the exogenous data that we just identified, the number could be significantly improved. So then the third approach is to assess the economic impact. I'm sure everyone right now is very aware of the economic situation, our unemployment rate, bankruptcy filings, stock market circuit breakers. So the model here is based on the results from prior stages, and then assess the economic impact on different industries. Also consider learning from other countries. Can we extrapolate the information from others to help us identify the proper actions? So then the third stage of this framework will be based on the risk assessment, different threshold for different criteria. So the system can generate different alerts to indicate a potential outbreak will happen in the near future. So then the last stage will consider the preventive policies and strategies. So based on the results from prior stages, as well as the policies implemented from other countries or states to provide policy recommendations. This includes, but not limited to, when and how long the quarantine policy is, based on the severity, what level of enforcement of the policy should be put in place, and so on. So the idea of this proposal is to examine the situation from different perspectives and to establish a framework to monitor the situation and prevent future similar outbreak. So we hope to utilizing different data sources, endogenous or exogenous, as well as the analytic skill that we have. We can capture the early signs or warnings of the epidemic, react timely, and have adequate policies or instructions to prevent this larger scale outbreak. And that's all I have. Thank you.